We're back with Good Day Chicago on a cloudy Wednesday. Really wasn't that long ago. Earlier this year, Chicago sports icon Ryne Sandberg shared that difficult diagnosis with us all, metastatic prostate cancer. And his recent passing has put a renewed spotlight on a disease that affects 1 in 8 men. Doctors are now urging others to take action before it is too late. Dr. Srinivas Vourganti, we're going to call him Sri, giving me the green light on that, of Rush University Medical Center is joining us to weigh in. Good morning, doctor. Thanks for joining us. Why don't we start with, what is the prostate? Where is it located? What does it do for a man?
Yeah, so most people have heard of the prostate, but it's a little bit mysterious about what it does. It's deep in the pelvis. It's wrapped around your urinary tract. And what it does is it makes the semen. It makes the, we know about sperm, but the sperm has to swim in fluid. So it's like the swimmers and the pool.
Gotcha.
And so it makes the pool. So.
All right, and prostate cancer has been often called a silent disease. Why is that? And are there any warning signs of it coming on?
Yeah, so the issue of warning signs can be a little tricky because most men are diagnosed based on blood testing and discovering it when they have no symptoms. They feel great, they have no idea. Maybe their prostate has been growing and bothering them for other reasons other than prostate cancer, and that can trigger an evaluation. But it's called a silent disease because most of the time it is silent, and it impacts so many people, so it's hard to meet a family that doesn't at least know some people or whatnot.
Is this something that typically gets screened during an ordinary physical, or is it something that we have to ask for specifically, hey, test me for possible, my prostate levels?
Yeah, it's interesting you should ask because most of the guidelines bodies do believe that prostate cancer should be screened for, usually starting at age 50, no matter who you are. But about 10 years ago, the guidance on prostate cancer screening became a little softer, and the amount of screening that happened went down a lot. And I think then it wasn't right away, but as a result, we believe is why more and more of this distant cancer is popping up. We don't know for each individual if that's the reason because it's always been the case, but screening can help us find it before it's spread.
Is there a high-risk group of men, any habits or, something in their genetics that might be a warning sign to, hey, make sure you check?
Yeah, so I think because it's so common, all men need to worry about it, but you're absolutely right. There are definitely family histories, so if your father or your brother had it, that doubles your risk.
Oh, wow, that big of a difference.
And in a community like ours, the African-American community needs to worry about it a little bit more than the other races in the United States. And then certainly now we know people, just like with breast cancer, there are genes that run in families. We know that there are genes that run in families that drive prostate cancer too now, and so we've reached that point. So
now this is a fairly successful treatment if it's diagnosed early enough, isn't that correct?
Yeah, so for most men, they say that if you have prostate cancer, you don't die with it, you die of it. It's the other way around. You don't die of it, you die with it of other reasons.
Okay.
And so, but that flips if we find it too late. So if you show up and it's already spread, and this happens, and I meet people like this every week, where they're maybe screening didn't happen, or they just got very unlucky, and these patients will often die of their disease.
Gotcha.
But we do have lots of treatments. There's so many treatments.
And Sri, into the camera, make your plea for folks to come and get screening.
Yeah, so Rhino brought it to our attention, and he was so brave. He shared his story, and I want you to go talk to your doctor about it. It's extremely important, and it can, not only for the men, but for the women, bring your brothers and your husbands and your family members, especially if it runs in the family. So
that's terrific. Sri, thanks for coming in today. Appreciate it. Great advice, and keep up the good practice there. Yeah, you stay there. Natalie, over to you with the mega poll.
Yeah, I just want to say thank you so much for sharing that message. We're dealing with it in our family, and it's a lifelong battle if you don't catch it early. So thank you so much.